All right. Well, welcome to the inaugural Wellness Wednesday. I'm Dr. Jeremiah Stevens, and my wife, Dr. Julia Stevens, is here as well. And our plan is to set this time apart every Wednesday at 12 noon Pacific time to have just a conversation about a health topic or something of interest. And so we're going to be putting links for future ones on our website. So if you wanted to join us live, you're welcome to do that. And if you're live, you're able to ask questions through our chat. You can do reactions and different tools that are part of this program that allow you to interact with us and make it a little bit more of a conversation and go from there. The videos will be put on our website at terraintherapy.com so you can watch past ones. Also, if you register for the webinar, you'll automatically be sent a copy of the webinar when it's been finalized, which is usually about an hour or so after recording. So that'll be available for you. Um, so this is our inaugural one. So we kind of wanted to talk a little bit about who we are, what we're doing, what terrain therapy is. Do you want to introduce yourself and how we came to be and how this process started?
Sure. Well, yeah, so Dr. Jeremiah mentioned that we're both naturopathic physicians, and this is a different perspective of medicine that is available to all of us, but it's also a approach that's lesser known and has been getting more discussion and conversation. In the last couple of years, we've had a lot of just collectively, we've spoken a lot about our bodies and our immune systems and staying well. And through this process, like, I don't know, I think the pandemic was kind of an eye opener for us because this is a situation where all of us had to take in a personal measure of how healthy am I and what's the risk of me and how I'm doing, and what's the risk of getting sick. And then that played into what activities we did in our daily life. And people do that in different aspects when they get their own health challenge put right in front of them. But I feel like collectively, we went through a process together, and then some people felt very comfortable, or we all chose our own path. Some people felt better staying in. Some people did not feel comfortable staying in and were looking for ways to help guard them or boost them to go out and play in the world. Um, just that example right there is one example of many of just a different approach to medicine. So my practice coined the term terrain therapy. And terrain therapy, rather than it came about, rather than kind of medicine being a system that you follow an outside recommendation, instead more pivoting the conversation piece to be focusing on the person. In our more mainstream medical experience, we tend to go to the doctor, we have complaints, and then the provider that we're working with identifies, what the issue is, what the disease or the problem is, and then going down a series of interventions based around the problem. There is another way out there. When I work with people in naturopathic medicine and holistic and other providers who are more of a vitality holistic mindset, often called also functional or alternative medicine, but it's a different style of medicine. And rather than being focused on the disease, you're more focused on the person and then building a protocol based on what's good for that individual person. I feel like I'll pause, go in a few different directions, but
So I think the term terrain kind of came from there's a famous quote from Dr. Louis Pasteur, right? It's where you kind of
mm-hmm.
came up with the idea where he was the one who came up with one of the predominant proponents of the germ theory of illness, that it was, he identified that there were these bacterial pathogens that were causing illness. And that is definitely true. The bacteria does cause illness. But on his deathbed, he said, actually, the germ is nothing. It's the terrain that is everything. And I think the concept being that we're surrounded by bacteria and viruses and things can make us sick constantly, but it's really our own body where we sit, how our terrain is, if we're healthy enough to where these things, we're able to fight these things off, or if they overwhelm us when our terrain gets compromised and worn out. So for me, I like the term terrain. It resonates kind of deep in my spirit that's what our focus should be more on is how to build up that terrain so that these things that we are constantly being bombarded with aren't going to overwhelm us and we can keep functioning through it.
Yeah. And, something that we're not all built the same.
Correct.
And so just being, you know, I'm human and therefore a headache needs ED and you don't ask questions or where did that come from or what's going on? We all have our own unique vessels, our own bodies. Our bodies share our stories, of what the things that we've been through. We've As we live in these bodies, we can't live without gravity on this planet. And so we've all taken hits and falls and, had accidents or whatever, gone through experiences. And our bodies start to accumulate the effects of these experiences. And so a body that has been able to rest and eat nourishing food and feel safe and have good elimination, give that a period of time, that is a very different terrain that that person is working with than the body who is constantly under stress and many different stressors and maybe doesn't getting its base nutritional needs and maybe isn't, one way or another experiencing emotional abuse and maybe, XYZ and being exposed to allergens or being exposed to some sort of outside chemical that is causing irritation and inflammation in the system. You take the same person and you can do a lot with who we are as people and love on ourselves when we're all human and we have a universal experience of living in bodies. And when our bodies, when our health goes in something you don't want, it's like when our health is going well, we don't recognize it. When our health is not going well, it can often be this nagging irritant. When our health goes way offline, all of a sudden we can't play in life anymore. And then at that point is when health becomes your most important thing, because you just want a vessel to be able to explore life with. You want to be able to connect with your loved ones. You want to have that time together. You just want to go play. People have to be well enough to actually remember play and joy and the good things. For us to get to a good state of wellness and health is actually much easier than we think if we're actually empowering the person and keeping the conversation all about the person. Sometimes health is a intimate dance between the person and I think our bodies are created. And so just the idea, the concept, let that sink in a little bit. Our bodies are actually created. We have these divine creations that are magical works of art that are kind of like walking miraculous water balloons that also have our history, that is an example and responds to our environment. And you pull this all together and it's like, wow, we're actually alive. And so if you let these big things kind of sit in, then when your stomach is having, when you're having stomach aches or when you're having headaches, it feels almost awkward to be like, oh, well, just take some ibuprofen. Oh, that's not working. What? Oh, hold on. We have a disconnect. I feel like the modern support of like just the classic mainstream experience of going into a clinic and, hey, I don't feel well, take your vitals, take your temperature, going through that process. Those medicines are often band-aids to help the person in that moment of that tough time. But the actual big picture healing isn't going to be found in that capacity. And that's where I think we are walking around and making it harder on ourselves than it needs to be. Because I think we all want good tools when we're feeling terrible. But we have this mainstream medicine process that has been built on all of these fancy tools, and we're kind of totally missing the conversation of these amazing bodies we have and how we can actually promote our own health and well-being that is way more powerful than a outside pharmaceutical product. You know, the real power of healing is not on the outside of us. It's actually by claiming our agency and learning about our vessels and figuring out what environment works for you and what doesn't, and what food works for you and what doesn't, and what movements work for you and what doesn't, and you know what types of relationships work for you and what don't, and going through this process of guarding and protecting your own vessel. When you help someone jump through the hoops of empowering themselves to actually have a health agency and be able to kind of be their own advocate and their own player, then all of a sudden they're welcome to, I mean, it is 2024, will be 2025, not far away. And we have so many tools out there. There are amazing tools, both in the, you know, chemical side and the natural side and the woo-woo side and the electrical side. I mean, there is so much out there. But not having a relationship with yourself and some basic plans, it's like you don't even know how to access these things. So part of terrain therapy is to just help foster some conversations of teaching people how to actually take care of their own bodies. Our bodies are amazing. We are healing all the time. And when we're not healing, we're usually putting some pretty annoying symptoms out there. Now, if we can get numb to ourselves and kind of turn it off, but the process of relearning and re-looking into yourself to develop that relationship, and that will help guide you through to your best health, is it's awesome. It is so, I think we kind of forget that health miracles can happen all the time. And when we really need those health miracles, you're never going to find it in all of these things out here. Like that intuitive within, spending that time, that quiet time with your creator within, for that not to even be kind of discussed or honored. I don't know. I just feel like we really steal the empowerment out of people in kind of this false paradigm where we're told like this is the only way to heal. And the reality is it's not true. And a lot of what people struggle with are not this year's problems. I mean, there are things that have been going on slowly for, you know, oftentimes a decade before it actually becomes such an issue that people seek care for it. But if we know how to take care of ourselves from the super get-go, if we're really paying attention to, are we getting water and are you pooping and how are you eating your vegetables in a very simple way, that adds up to very, just a brilliant state of health. Oh, did you actually ask?
I think that was great. No, I think,
Does that give you a better understanding of terrain therapy? Because even this terrain therapy has just been the soul project in my heart.
Yeah.
I feel like
there's just the phrase alone, terrain therapy resonates well with me. It just says, because like Western medicine is so focused on, you know, identify a symptom and try to knock that symptom back. And it's almost like it's sort of like a battle, like metaphor, if you will, like you're fighting against this disease or this, you know, infectious agent. And it's like you're going into this war concept. And I don't know, it doesn't feel like an empowering place to be for health. It feels sort of dehumanizing and depersonalized, where it's like, I don't know, I think oftentimes it's the person with an illness that's more important than the illness the person has. And, you know, I've always said, like, I've seen, you know, we've seen how many hundreds of people with hypothyroid, but I've never met two people that are identical with hypothyroid. So it's more about the person that's having a thyroid issue rather than just go, oh yeah, you have this illness, you know, take X. And so, yeah, I mean, there may be some similarities with across the board with people who have similar ailments, but oftentimes still there's a personalization process that has to be done where you look at the exact person with that illness and be like, where do we need to start here? What areas in your life are out of balance? What aren't you doing well to take care of yourself what aren't you fostering that would promote wellness and more well-being in your person, whether that's in your social interactions, your physical activities, your rest, your hydration, your nutritional status. All those things come into play for sure, to make you who you are and to help, you know, thrive, even if you have some sort of debilitating illness. Sometimes we don't, there's some
That's
illnesses
when
that
you need to be empowered all the more,
yeah, for sure. Yeah, I mean, I know,
you know?
I like that. There's sort of a metaphor of like an optimal spot that each person can get to, an optimal curve, if you will, for each person. And that high point is different from every person. Like I've had back
Mhm.
issues and a tumor on my spinal cord, and my personal high is not going to be the same as like a 18-year-old top athlete, it can do
Mhm.
remarkable things on the field or the court or whatever. I'm not going to be able to do those things, and that's not the same. That's not my optimum is the same as theirs, but my optimum is still better than where it's something I can still strive toward for each individual person, because we all want to feel as good as we can. But we may still have those
Mhm.
limitations, but you can still feel, almost always you can feel better than you do at the moment if you start looking and taking care of yourself. One of the things, I've never met a person I didn't feel like we could help in some capacity. I don't necessarily know if we're going to be able to cure every ailment that walks in the door. There's some things
Mhm.
that aren't just innate and they're going to be with that person, whether it's a genetic illness or an untreatable something that may just be that person's challenge that they have to live with. But there's still places to improve and how we can help that person manage whatever that is, and be a better get closer to that kind of hypothetical optimum level that they can reach, if you will.
Well, and yeah, so we all have our own unique space. It's like bringing back patient, client, person, human-centered care. Back to the terrain. And whether that's your mind space, whether that's your body space, whether that's your physical environment space, I mean, it's pretty hard to feel good when you're living in a poisonous environment. Like we have to kind of make decisions and protect and guard our health. But then even when it comes to what do I do when I don't feel good? Well, I love all of the specialists in our current paradigm, but we are kind of sorely missing like the generalist, just the like
Yeah.
super basics that don't have any Latin words in them, because so it's like, yes, you've got your kidney specialist and you've got your liver specialist and you've got your endocrine specialist. And okay, but what about just stepping back big picture? How do we help minimize stress and promote healing? We
Mm.
don't always have to make it so um, technical. And there is technical minutia, and you can get excited in biochemical pathways. But sometimes, like if the body can't rest, can't eliminate, and can't bring in nutrition and hydration, you know, what the stress accumulates. And so then what one person might, when one person's stress might bend them in one way and another person's stress bends them in another way. So you can have two people side by side, and one person, their stress buttons go and they're getting headaches, and another person, their stress buttons go and they're getting stomach aches. But sometimes they're not the cause that is causing people to get offline here at feeling well, are very similar, even though their expressions might look totally different. There's that
Mm.
concept too. I mean, sometimes we're making it way more complicated. Like it is hard to get good breath if you never poop, like let's not overcomplicate things. Um, it's all the inside that needs to be able to release its cleaning. So, or release its toxic waste. I know that was kind of a sideball, but the idea is like sometimes health doesn't have to be that complicated. um,
Yeah.
we have some basic generational wisdom that has been kind of disrupted. I think we've had a unique marketing. Pharmaceutical companies are very, very powerful in this culture, and we've kind of passed over our power over to our doctors. And in some situations, that can be wonderful, but in some situations, that is just wrong.
Mm.
We don't need to throw medication at every single issue that happens, because we're not helping the body heal. We're just kind of telling it to shut up over and over and over. And at some point, the body needs to actually heal, and it's going to heal one way or another. But if you want a longer ride in your vessel, it's nice when you actually work with your body to help encourage the healing. And gosh, you mentioned your injury. We've all been through stuff, but then when you kind of grow through it, the wisdom and the growth that you gain, but change and growing never is very comfortable. So sometimes we want like the immediate relief, and it's important to offer relief, but we don't want to only focus on relief while there's still something decaying lower, below the bandage, if you will. In the big picture, I think we have a responsibility to ourselves and to our community to encourage real healing, so that when you come through the storm, you're better for it. You're not just pushing problems down the road, because it starts to affect all of us. It's time that we all have a better experience of wellness. It's the trickle down effect that actually I think could support every single human being. Better health is just a better way. But you can't say numb to yourself for better health. You have to actually take care of yourself. Bummer.
Yeah,
but
that's the
actually,
tricky part, right?
really good news too, right?
I know we want to hand off the healing to some outside force that,
You do
I
it.
just take this pill, or I just, wave that magic wand and it's going to be fixed. But it's usually not that easy. It's, there's steps involved, and especially because there's always some sort of emotional component with illness as well, that you can't ever get away from that, whether the emotional thing was the primary that caused the physical secondary, or vice versa. It can go both ways, and probably dances in circles together and keeps perpetuating, one perpetuates the other on a continuous cycle. So yeah, we can't just ignore the fact that there's this big emotional, black hole often associated with a physical ailment as well. And that if you don't really address that, the physical thing's never going to go away. I mean, you can put a band-aid over it for so long, but eventually that, the gaping a band-aid's not going to hold it all together.
Well, that's a lot of the chronic pain stuff. Like the type of work that when I do cranial sacral therapy, people come in and I, specialized in hands-on body work, but there is can't quantify it, but there is a proportion of nagging body pains that when you go to the actual area on the body tends to be unprocessed emotions, kind of trapped nervous tensions that are trapped in the myofascial system. As the person kind of tells the story, lets the emotions kind of bubble up. Sometimes there's a tear, sometimes there's just a walk down memory lane, but the person will usually tell their story in a way, and then the tissues will soften, will release, and it's like, oh, well, gosh, now that shoulder feels so much better. And I'm like, that was actually locked in your tissues. Our back to our bodies are amazing. We kind of have this assumption that we're just in these dumb, stupid things that don't work. And that is just, it can't be further from the truth. Like, our bodies are just, they're cool. They're creations of beyond this world. We don't understand them, and we're learning about them. But learning about them, it's how people actually get better.
It
You
sounds
got
like
to
you
learn
said,
for you. You don't have to be an expert provider for all people, but you got to learn about yourself.
yeah.
It's
And
an
I feel
aspect
like,
of train therapy. Everything's personalized because it's
and I
yours.
feel like that's what you're talking when you say like patient-centered care, or it's really about the person. How, it has to be in charge of their own well-being to some extent. You can't sort of, a top-down, fix from the outside is not really how you're going to get there. Modern Western medicine is sort of pivoted towards that, it's like, yeah, you see these specialists that are going to, focus on this one little specific part of the body that they're going to fix. And like you mentioned before, that just sort of the economics of medicine have moved away from, family doctors, family, you know, physician levels that really will look at you. Most primary care doctors are all, or primary care practitioners are not even physicians any longer. It's, PAs and nurse practitioners, and there's many great ones out there who are doing God's work,
Absolutely.
but also, I mean, just they also have less of, shorter training things, and they're often just looking at kind of checking boxes. You ask these specific questions, and if they say yes to something, oh, you need to give this medicine, or oh, yes, go to this specialist. And now they're talking about maybe, pivoting to AI can handle all this. It'll just be a computer. You put your symptoms in, and they'll tell you what you need to do. And I just don't really feel like we're that simplifiable, if that's a word, that we can take it, down to that just a couple yeses and nos check boxes can really determine how you heal through something. It feels like that's very outside the body. And even, maybe it'll get you to a specialist over what,
Maybe it'll
maybe.
kind of push this conversation even harder, though,
Hmm.
because I think people will feel so disappointed. Like, there's no way I mean, that will help only to a point. That helps people from dying, but that doesn't
Yeah.
necessarily help people grab onto life.
Mm. Yeah. And I mean, especially as we get an aging population too, there's a lot of people who are, kept alive, but how much of the quality of life is really there at a certain point too? It's sort of can be very disheartening seeing sometimes people just being kept alive just for the sake of keeping someone alive. And it's like, oh no, it'd be so much better if you could really thrive up till the end. That's what we all want, right? To have as long a healthy life as possible. We're doing great right up until the end, and then it's a very short decline and a easy pass. That's what we all want eventually, if we even take the moment to think about what we want, because most of us don't want to even think about the fact that death is a part of life, which it is, obviously, but our culture is
Right.
very denying of that. We don't want to think about those things being realities. But, as you look into like, levels of dementia and levels of debilitation, like illnesses late in life, that's, I think that's where really doing some strong preventative work in your health in your earlier years, and wherever that line is for you, it's probably, anything you do now can be helpful down the road, because that's really what we want to focus on, is staying healthy as long as possible.
Yeah, I definitely think the brain is the number one organ system to keep, like, to protect while people age. Like, we have to
Yeah.
protect our brains. And I guess that's just, I feel like, um, all of our, like, our brain, our focus and our mind, like, we got to protect our brains. And then it's like, okay, digestion, immune system, heart, but like, my goodness, we got to protect our brains. And the ability to kind of, to emotionally regulate. People are kind of outside of themselves instead of kind of all connected in.
Mm.
And, back to the empowering people to be in charge of their own health walk. I guess I just look around to a sea of sickness. I see a lot of
Mm.
people so stressed out. Like, I mean, it is not easy to be a human, and it's really not easy to be a human when you're feeling financial strife, you're feeling family strife, you're feeling, all of these unknowns. We're getting hit with a lot of stressors. We're getting hit with stressors you can't even see or taste or smell. I mean, we've got these electrical environments that are stressors on us in this modern world. We got food. Food now isn't the same. The nutritional content of produce now is not the same as 50 years ago or 100 years ago. Like, we've just kind of gone awry in so many ways that, where do you begin? And that's where I feel like terrain therapy is a solution to help speak about some very simple things that we can all start to, take care of our own, tend to our own backyard, take care of our
Mm.
own immediate space. One, you feel better right away. Like you get the win of your work.
Mm.
Um, And no one can take healing away from you. That's another thing. When um, with this system that you go and you take a pill for everything that bothers you, what happens if the pharmacy's closed and you can't get your pills? Like, oops. I mean,
For real.
when you keep it, I mean, when you use them as kind of last resort or for periods of time, but not necessarily the entire fix, which isn't going to give you the real fix you want anyways, you're not as dependent on it. You build your own reserves by taking care of yourself, um, which makes us a more powerful population too. But anyways, I don't
Yeah, I
know
do
how
feel like,
people do it without taking care of themselves. Like, how do people? It's just so much lies out there about how we actually get better.
and I feel like more and more people are starting to kind of become aware that like, wait, this something's not right. Like this isn't working. Like what I've been told is the only way is like there's got to be something else, right? A better way than this because this isn't working at all. And I think yeah, a lot of people are just kind of starting to question maybe what they've been told or the dominant thing paradigm out there, and saying, hey, wait, there's got to be something different I can do. And so I think yeah, that this is kind of a conversation about where do we go with that? How do we start on that journey? And like you
Mm-hmm.
said, like getting a little win, those wins can stack quickly, right? You start, get a
Mm-hmm.
little bit better, and then you keep, and then you're like, wait, I can get better, and then you want to do something else, and then that even I feel even better. So yeah, I think it's funny. We've had this conversation a lot where someone gets better, and then you're like, you go back and ask them like, well, how's this? And they're like, oh, I guess I haven't had that anymore. It's like, how's that cough that you complained about for 3 years? Oh, yeah, I guess that's gone. Or what about
Mm-hmm.
those headaches? I guess I haven't had a headache in a while. And it's like, once you don't have them, once the symptoms go away, it's almost like you forget you even had it in the first place. So it's, I don't know, which is, I guess, a blessing, right? It's kind of like a woman after labor, she kind of forgot, like it's like, they asked women right
Right.
after labor if they'd do it again, and most women said no. And in 48 hours, almost all of them said, yeah, I'll do it again. It's like there's
Mm-hmm.
something innate in us that, when things go away and improve, we're able to forget about how bad they were, maybe in the past.
Well, our brains are wired brilliantly to protect ourselves. So that happens in trauma too. When people experience something that kind of is outside of where they feel like they have the tools to process it at the time, or they don't have the resources to go, process the emotions, the brain will just kind of like shut it off. Boop.
Yeah.
It just goes offline. And so then you keep living through your life. But a lot of you can ask people like, hey, how are you doing? Oh, I'm fine. And then like, oh, I'm fine. No, no, nothing hurts, okay, living their best life, right? And then all of a sudden it's like, bam, oh, I didn't know my kidney stopped working, or I didn't know my heart's doing this crazy thing, but like you've been telling yourself you're fine, ignoring yourself for years. There is a process. We become numb to ourselves. So I think any sort of proactive care, like
Mm.
counseling, massage, body work, acupuncture, even exercising. Like
Yeah.
exercising helps to get people aware of their own body. We live in our heads and we don't actually feel our own selves. We just kind of run, run, run. Like being an
Hmm.
American is awesome, but we know how to hustle and run and we don't even know where we're going. You
Right.
know? Gosh.
There's not too many words that have so much charge behind them as the word fine, right? It's like
Yeah,
there's a
I'm
lot of
fine.
nuances and layers to fine when we say that, which is like
Mm-hmm. And
my old cantankerous grandpa used to be like, pretty crappy today, actually. Just because he'd like when people ask him if he was having a bad day, he's like, I'm not gonna say I'm fine if I'm not, which he was kind of a little interesting character, but I kind of respected that a bit. He wasn't just like, nope, everything's fine. Nope, everything's pretty bad today, actually. If you want to hear about it,
yep.
I'll go on further. And most people don't want to hear about it, so it's just a quick part of conversation, sort of social
Mm-hmm.
nicety, right? Oh, how you doing? Great. Oh, yeah, me too. Yeah, good. All right,
Mm-hmm.
good seeing you. Which
Mm-hmm.
that doesn't really lead to very in-depth conversations. The conversations that that afterwards you're like, wow, I really felt like I connected with that person. You have to get past the fine and really talk about what's real, which is
Hmm.
you have to have some trust there and you have to be vulnerable and all those things, which is, a lot of times we don't want to go down those paths.
Well, and sometimes there's just your body's just giving you a feeling. You don't even have like the words for it. You're not even
Yeah,
sure, you know.
true, true.
But like I would say if we're just talking about the body and like little signs, when the body starts to go right, like as parents, I feel like you can watch it more in kids, but it's like when someone starts to startle, like they're real jumpy all the time, like, oh, what's going on there? Or like
Mm,
when sleep is getting disrupted and person's not sleeping right, like, oh, okay, what's going on there? Things not when your appetite is either like you can't stop eating or you have no stomach for eating. Like, okay,
mm,
well, like we're kind of
yeah.
just these are things we don't treat, and but at the same time they're like clues of like, hey, what's going on? Do you have all that you need for your body? Like, you know,
Hmm.
um, I mean, we tend to run low in nutrients as a society. We all could use a nutritional bump. We tend to not let go of our garbage. We tend to underhydrate. We tend to have issues with constipation or diarrhea, but either way, you're like the middle tubing is not happy. Um, and we tend to have issues with anxiety and depression, which I think are direct relationships to these physical things, but we kind of segment it all. And really, our bodies are just trying to share, hey, hey, help me, give a flag. Hey, help me.
Yeah.
But no one can hear those little nudges except the person. And you can share, hey, I've got this weird thing going on. What do you think?
Hmm.
But when you go to the doctor, they are not magic. They can't like see into your soul and figure out what's going on. They're asking you questions about how you're doing, and sometimes we don't even know. We're just like, everything's fine, but order labs. Like we're hoping the labs are the magic that's going to show you what you
Right.
okay, or like maybe we'll take some imaging and okay, but it's your experience in your body that is powerful, and
Right.
it just like crossed over. We don't even. It's like we're void of even talking about that part, and I don't know if it makes people uncomfortable, or I don't know if it's because it's not a protocol and there's not a pill for that, but how we're feeling in our bodies makes a difference. Someone knows if they have a stomach ache or a headache or junky sleep,
Right.
or plagued by nightmares. Like, yeah.
Yeah, I remember when we trained, which was a bit ago now. We've been around a little while now. We met in school back. We started the week of September 11th, right? 2001. Once
Mm-hmm.
the students were
The
able to start
September
with us
11th.
because the
Yeah.
planes were grounded, so they couldn't even get there. But we were started in the same class in 2001 at Bastyr University in Seattle. And back then, I remember one of the things that stuck out to me. I remember one teacher saying, like, really 80 to 90% of your diagnosis of people should be just from listening to what they say. And then you use labs and imaging and confirmation tests in physical exam to confirm that last 10 to 20%. And I feel like, yeah, modern medicine has kind of become super enamored with its tools, its labs, and its imaging, and forgot, maybe, and then also the nature of insurance reimbursement, where you only have a few
Mm-hmm.
minutes with each patient. You they don't really want you to focus on taking that time to really listen and try to figure out what's
Mm-hmm.
going on with someone. And that's, I don't know, I think the strength in naturopathic medicine has always been our willingness to take a little more time with people, to listen a little more in depth and try to figure out who that person is, what's really going on, why is this illness there, rather than just being, looking for a couple things, couple keywords, and then yeah, send them out for these tests, and then, oh, your cholesterol's up, you need this medicine. It's like, well, wait, why is the cholesterol up, or why is the blood sugar up? Yeah,
Mm-hmm.
we could put some medicine on board to knock that symptom back, but is that really curing what's going on or the reason why those things are there in the first place? I think it's,
Mm-hmm.
figuring those things out takes a little bit more time than just a couple minute visit.
Hmm. But also figuring those things out can be shared. It's not like this exclusive knowledge that no one knows.
Right.
I mean, yes, there are healthcare providers out there who are trained. And so please go take your case and pick their brain and find someone on for your health team. Um,
Hmm.
but a lot of providers will start in the similar area. How is your sleep? How is your
Right.
appetite? What are you eating? How often are you eliminating? What hurts? Like, so you could kind
Hmm.
of start with taking yourself through some of this process. It's like picking up your house. Yes, you can absolutely hire a house cleaner. But if you only have a house cleaner, that is a different level of feeling empowered over your house. Other than, like, there's times when you do a quick pickup, there's times when you do a deeper scrub, there's times when when you hire an outside person to come in and help you get past the thing that feels daunting. Okay.
Yeah.
Or the outside service like helps gives you structure, like accountability structure. Okay. But
Hmm.
if you have no idea how to even pick up a sock or wash a dish, how clean your house can be and how comfortable your house can be without outside help is a very different picture. I don't know if that makes sense. It's like sometimes the basics really, really, really make people feel much more comfortable and much better in their own body. And it's like, hey, it's just
Yeah.
dishes and picking up the socks. Like,
Right. Right.
you got this. I know you can. So I
Oh
just
yeah.
feel like we can really, health is I feel like health is the magical when it all comes together and people actually feel well. That's
Mm.
awesome. That is
Yeah.
just that's all the good stuff. No,
I'm
that's
gonna
my
put
hope.
you on the. I'm gonna ask you to answer a couple of questions before we wrap it up. One would be,
Okay.
um, and I'll answer the first one myself too. But
Okay.
for like why, like what led you to go down this path towards naturopathic medicine in the past? Like how'd you end up where you are? And then second, if you could give an example of a kind of a successful person, case or client that you worked with that you kind of use some of these tools, with obviously without identifying information, just kind of, share that story. So I'll give you a second to jog your memories on those two questions. Well, I'll just tell my story how I got into naturopathic medicine. So, my father was a psychiatrist, and I think I knew from a little boy that I wanted to go into medicine. It was the only thing I ever wanted to do. It was kind of just always the vision. So I went to, college and got my undergraduate degree in biology, biochemistry, and was then like kind of going back and forth between conventional Western medical degree or naturopathic medical degree. I kind of got exposed to both as a child, as my dad was in Western medical. My mom had a lot of health issues that were not helped by Western medical doctors, and so she sought out alternative health practitioners like naturopaths and acupuncturists. And I saw that she was helped more in that environment, so I was like, huh, there's something else out there. So kind of after I finished school, I took a job in an integrative clinic where they had medical doctors, naturopaths, acupuncturists all kind of working together, and I got to see how each doctor practiced and how their patients responded, and it just resonated for me clearly that naturopathic medicine was the direction I wanted to go because I saw the patients really engaged and happy and improving, much more so in that sort of model, and I do. So it just kind of that clarified for me for sure the right path, and that's what led me to Bastyr, and that's where I met Julia, which was so. In addition to getting the training, I got a beautiful bride and four wonderful children. So, yeah, it was obviously a good choice. So, I'll let you answer your version of that if you'd like.
Sure. Yeah. Thanks for sharing. Always nice to hear. Um, so let's see. I grew up not exposed a lot to the regular medical doctor. I grew up in an era where we didn't have insurance and we didn't go to the doctor very often at all. My father, actually, my grandparents, um, and cousins and aunts and uncles and father, but they're all chiropractors. And so I grew up in a family. My dad's side was all chiropractors. We didn't go to the regular medical doctor very often. There was a couple of times I remember, and they weren't super positive experiences. So I had a little chip on my shoulder there till later in life, some healing. And there, but I was exposed at a young age, this concept that the power that made the body heals the body. And so that your body is smart and trying to, and that, you know, the chiropractic understanding is that your nervous system, your brain and the spinal cord and the peripheral nerves, but that you need this vertebrae need to be open and not pinching on nerves so that the communication, the big idea is that the communication needs to happen so that the body can have better health, best health, keeping the communication open in the nervous system, in the body. And I wanted to help people with health. I thought that the body was this amazing thing. And at the same time, I feel like I remember sitting in undergrad, and I was pre-med at the time. I didn't know which direction I was going to quite go. I was thinking more traditional, like mainstream medicine. And I wanted to not just adjust people. I felt like there was more to that conversation, that like kind of the chiropractic exposure, but like, can you do that with all your medicine, or is it just back pain and neck pain? Like, what is the body trying to do? How do we help the body heal itself? Was kind of just seemed like a natural question to ask when you're sitting with a doctor. And I felt like that very basic question, hey, how do we help the body heal, was never really talked about. And that's, I guess, what I wanted to help bring forward to people. It's like, hey, how do you help your body heal? What's your body asking for? What's going on? We feel like we're separate to actually engaging and taking care of ourselves. So I get excited about this concept of more like vitalistic medicine rather than mechanistic, like the idea that our bodies are actually alive, and how do we work with the body to get better health? So I found myself I applied to Bastyr. I also applied to a couple of chiropractic colleges. I had also looked at, pre-med. I was kind of figuring it out. And in my undergrad, there was this moment. I was sitting, it was an 8 a.m. class, and I was staring out to this beautiful forest, and the sun, it was a cedar forest. I was in Santa Cruz at the time, and it was like the beautiful smells and the like fog coming off of the morning sky. And I'm sitting out looking and like hearing the birds. I'm like, and there was a very dry medicinal chemistry lecture going on. He's like, oh no, the bond angles, we need to switch the bond angles. It makes the medication more pertinent to the virus. And these are things that scientists do to make the medication stronger. And I'm looking out the window and I'm like, why are we so focused on tweaking one molecule when like our bodies have all of these systems upon systems upon systems, and we're kind of not even talking about that? Like, yeah, we can put our focus on like, how do we make the weapon more weaponized, but like, what about our amazing bodies that we just kind of take for granted? Like, we wake up, we're breathing, we're interacting with people, we're walking. We don't even pay attention to like this amazing thing that's right underneath our noses. So I was always just kind of taken with like, okay, so how do you actually help the body heal? Like, how do you help the body heal? Period. And I am so excited that there's all these different specialists, that medicine has all these different, like a mosaic of different people who have their own little understanding about their own little pieces to the puzzle. And I just think we're in an era where we really need to just encourage people to be first and foremost our own best caretakers. Like, our bodies are amazing, and if I could help someone in understanding that their bodies know how to heal, and then doing things to support that body healing, that's what just my whole heart fell in love with that. And so that's been my pursuit, forever, is what it feels like. Even I pursued a lot of hands-on training because I do have sensitive hands, and that family of chiropractors, the apple never falls far from the tree. But I didn't think it was like alignment alone. There's your whole body's vitality, your story, your environmental factors, all of it. It becomes a whole story.
Hmm.
And that's how I like to help people heal. And also, it kind of feels silly sometimes that we're such a specialty because um, we all have bodies and they all are trying to heal. Like some of these conversations don't need to be so um, they don't need to be so private in a specific niche medicine type of practice. It's like, okay, guys, but can we all just kind of start talking about how our bodies heal? You know, there is a collective conversation. People are hungry. They're waking up, I think, and they when you've trusted your doctor forever and then all of a sudden you don't trust your doctor, or the system, you know, people might have really great practitioners, but like they're kind of questioning the overall system. That can be a scary place to be. I really
Yeah.
feel like we're here at a kind of this transitional type of conversation. You talked about AI and medicine. I mean, that could be really fascinating. But I think that people are also going to feel the deficit of where the care is, and it might actually encourage people to even more so pursue wellness and like whole body approaches to healing. I don't know. I love one of the reasons I chose also a naturopathic medical degree. People don't realize you can study and study and study, and we have different licensed providers. But when you have an MD in your state, or there's standards of care. So if people present with certain symptoms, you have to do X, Y, Z, and that so that you're kind of solidifying and making kind of mainstreaming the approach. Well, as a naturopathic physician, I'm not bound by that. And some people don't like that because it's like, wait, you had a sinus infection, the first thing you need to do is an antibiotic. Okay. But what if they've already tried that over and over and over? So truly, people often will cross paths with me when they're looking for a totally different approach. And because I'm not bound to a specific like care protocol. I'm still bound to the same honoring you, not causing harm, supporting your body's health. But I don't have to follow XYZ in that exact order. I have the ability to advise a personalized plan that's specific to what we see in this, you know, in the conversation of talking to the patient. I feel like I was able to not perform, but participate in like out of the box medicine, which is a little more supporting the person, which I think is a little more in the kitchen and in the home too. You know, I
Yeah.
love teaching like also like moms or like just influential people in the family. You know, when you teach a parent, then they're going home and they're telling, you know, they're helping their own child. It ripples because we don't all need degrees just to take care of ourselves.
We've definitely seen scenarios where you see one person in a family, and next thing you know, you've seen everyone in that family, and then you start seeing the grandparents and the cousins, and pretty soon you go like, you know, treating everyone, but that's kind of cool too, because you get to see the whole circle of family dynamics, for better or
Mm-hmm.
worse
For
sometimes.
better or worse, you know, we're only human
Yeah.
and humans can stink, but also humans can be amazing. You
Right,
know,
right.
we just kind of have to be real with ourselves.
Yeah,
And
something you
delight.
said reminded me of
Say hello.
one old naturopath. He talked about it. He saw like all medicine as included in naturopathic medicine. Like we can use medications, we can recommend surgery or refer to a specialist, but you know, we have a much wider tool chest than most because we have, we know about herbal medicine, we know about homeopathics, we know about, hands-on therapies, we know about Chinese medicine, to some extent. We get a
Mm-hmm.
wide exposure, and then we kind of pick the areas that we tend to specialize in, but we can utilize all those through referral networks and things there. So yeah, just because we have a not ND doesn't necessarily mean we're opposed to a medical degree intervention of things
Not
here.
at all. It just has to make sense for the person.
Right. Has
Yeah,
to be at the right level.
I'm all
But I
about the
think we also,
latest
yeah,
and
people
greatest.
often jump to those higher level interventions so quick, and it's like, wait, we could probably do the same thing with like an herb or a nutrient, rather than jumping right to a
Mm-hmm.
prescription or a more drastic intervention that could have more side effects too. So
Mm-hmm. But then at the same time, if someone wants that elective procedure, go for it.
Yeah.
Now we're walking in for or even it's not elective. Maybe it's it's a heart
And then
disease
what else can we
situation
throw
that's
on
been
board?
growing.
What else can
But
you throw
then
on board to make that be more effective, make the healing better, limit, cut down on
exactly.
scar tissue, support
Yeah.
these healing systems and whatnot at the same time? Because yeah, that can often make things go much smoother and better for sure.
Right. Let's focus on the art of recovery.
Mm.
You
Yeah.
know, that's really what we're talking about, the art of resting, the art of recovery, how to help promote your health.
On the
So,
last couple minutes, do you have can you think of a patient example of someone kind
oh,
of you've seen
I don't
kind
even
of
know where to
using these
begin.
tools get better?
I take for granted, like I just get used to it. So it is not uncommon for me to be like people have seen like, oh, I've already been to the Mayo Clinic. Oh, I've already seen multiple specialists. I've already, I've seen 12 people and, they've been seeking for years. What's going on? What's going on? What's going on? Okay. And in and out of the hospital, like super sick people. And I don't mean to, like this one woman, she was hospitalized multiple times for a breathing issue. This was back in our Liberty Lake office. Oh gosh, Maya was in second grade. No, yeah, younger than that, kindergarten. And it was like, I'm like, what's going on? Oh, and I always get nervous, like, oh, okay, well, God, this must be really weird because people don't want to just have like the regular asthma. They want to have the worst asthma you've ever. Oh wow, okay, and you're listening, and you're okay. And then it's like unrelated, oh, but I get this weird, funky, gnawing gut pain. Okay. So I'm like, well, while we're figuring out what's going on with your super exotic, most amazing, but worst condition you've ever heard about, I'm just going to go through a regular protocol. And we did some parasite cleansing. And this was one of the first rounds of parasite cleansing. Well, use some compounded generic medication that was safe for her body that we went through and kind of like, okay, while I'm figuring out what to do with you, I'm going to start with where I know to begin, help clean out the weeds in the gut. She didn't really think it was a big deal to share that she had copious eliminations of all of these little like white styrofoam balls. It's what, like, okay. Well, 2 weeks later, her breathing is fine. She's not, like her this really unique strict asthma she was on 4 different medications and all of a sudden it's like someone gave her a new lease on life. Her lungs felt great. She slowly stepped off of different medications because she was on all these medications and still not breathing well and still showing up at the hospital. We did some simple parasite cleansing, and all of a sudden she's feeling so much better. Well, I go back, and this is when I figured out that there's a certain common weed that has a life cycle that goes through our lungs, and this was causing this woman's asthma. And so just by clearing out microbes that were being hostile to her, clearing this out, it gave her a new lease on her lungs. And I'm thinking to myself, okay, we spent some time in Costa Rica. In Costa Rica, public health initiatives, they do parasite cleansing twice a year for all of the school-age children just because it's that month and they do it. Here in this country, we never do that at all. So here this woman is consuming high amounts, she was on 4 different asthma medications, and it was still not giving her the results she wanted when we did a simple parasite cleanse and all of a sudden she breathes better. I think we're underestimating the ability when you clean the system out, help promote health, help promote the nutrition, that we can get better. It is not normal to not be able to breathe all the time. Like we kind of just, one more fancy thing, but are we actually getting the bottom line results that we want? I mean, I won't say her name out loud, but like that woman taught me that that sometimes the answers are much simpler. Mm-hmm. And you best believe that I've never had an adult asthmatic that I haven't at least brought up the conversation, have you ever done any parasite cleansing? Because it might be a process for you. It might be a contributing factor to your health.
It almost
It's
feels
not
like
all of it, but it could
we've
be.
forgotten that parasites exist in this country. Like, if you have animals or if you've traveled anywhere of note, there's a pretty good chance you may have picked up some little friend. They
I
still
mean,
are
we
around.
clean out our animals. Yeah.
Yeah, we don't live in a sterile environment by any stretch. Our bodies were
Our bodies are not
designed to
sterile.
interact with these things, and but they can definitely take us down. So
Well, and
awesome.
they're stealing our nutrition. Darn it. But anyhow,
Yeah, right.
yeah,
Borrowing off of us. So,
yeah, exactly.
well,
So,
I think we
all
will.
right.
Unless you have anything else to say, we'll call it there. It's nice having a little bit of.
I'm looking forward to this. So, yeah, Wellness Wednesdays, just to help. We're going to go through rotating health topics. And I understand that some things are, need to be discussed maybe one on one with a private practitioner. But there's also other conversations that sometimes people just need encouragement. They already know, like, oh, yeah, I was thinking about doing this. Do you think that would be a good idea? Yes, yes, do it. Try it. Yes. Just
Mm,
experiment, bring back the play in regaining our health. Just try something. You don't like it, then stop. Try something else. I think the
mm,
bottom line is people just need to not give up.
yeah.
The people that I've seen do really well, it's simply because they did not give up on themselves. Like
Mm,
our bodies are trying to heal all the time. So that's,
awesome.
we just need to not
And
give
at a
up.
minimum, if nothing else, it gives us an hour each week to chat with each other because we live together and cross paths regularly, but sometimes we don't actually take those quality moments because life gets busy. So it was nice getting to chat with you at
Oh,
least for an hour. So
yes.
enjoy
Meet
the
you
rest
back
of the
here,
day, and
same time, same place.
I'll see you next week, if not sooner, like this
I'll
evening.
hope for sooner. All right. Sounds good.
All right, take care. Thanks everyone for
Bye.
watching. Bye.
Yeah.